Write your comment, write a question. Write a question. Guys, write your questions. Write your questions. I don't know. That's a good question, actually. That's a good question because at the moment, I'm just like, it's extremely boring, the YouTube questions. I hate doing the YouTube questions, but I do them because it's consistency, and that's kind of like what you have to do. It's about doing things you don't want to do. I used to, but if people, I don't know if people get offended that like I don't like or acknowledge their comments. I used to respond to all of them too. I'm going to close this down if no one comes. And then I won't do a live stream for a while. 3 weeks to exam advice, please. What do you think about NBME 32? Obviously do NBME 32. The situation is that you've got to do 20 through 31 in the final 3 weeks, right? That's the whole situation. I don't know, Doha, if you've been in my prior live streams, but the final 3 weeks have to be 20 through 31, and you'll end on NBME 32. And it's not that it's magically different or anything. You're just going to finish on it. So you'll do 20 through 24 offline. Have you done any NBMEs yet? You want to do 20 through 24 off, or 20 through 25 offline now, because they took 25 offline. And then you'll do free 120, and then you'll do 26 through 32. Yeah, it is annoying answering the same dumb questions every day. But we're also extracting reels and shorts from these. That's also something we're doing. But people get complacent, you know what I'm saying? So like if I'm doing this right now, but I might just not do another live stream for a while. You know what I mean? Like if people feel like they don't need to come, then I'm just not gonna, I won't do one of these for like a while. How do you get a good letter of recommendation? Well, you've got to rotate. It's more about the location that you get it from, because you could get embellished letters of recommendation and they know that. So it's more about you getting a letter rotating at a place that you want to be at as an intern. That's what it's about. Like they'll probably look at whether it's from someone at their institution first. That's what they're going to look at. Which order do you recommend? Your question is UWorld first pass, then goes to Mehlman QBank, then goes to UWorld second pass, or Mehlman QBank. Why would you put UWorld before Mehlman QBank? Why would you do that? Are you saving best for last? Is that why? Is that why you do Mehlman QBank second? Save best for last, so you can warm up with the inferior resource, warm up with UWorld, and then go to Mehlman QBank. Is that the plan? You would never do UWorld second pass. That's never anything I've ever recommended. Even Mehlman QBank, like we'd be flattered. We'd be flattered that you want to do a Mehlman QBank second pass, but you can do one effective pass. That's what you can do, just one effective pass. And then we can have you on the NBMEs. And only if your NBMEs are unsatisfactory might we have you go back to QBank and corrects for remediation, something of that nature. But you shouldn't think of it as like inherent to your prep that you're just going to do a second pass. We don't need you to do that. The 128 man. While doing UWorld, I often go over 1 hour. You're doing a tutor mode untimed at 60% completed. When should I be worried about my question timing? You don't have to be worried about your question timing doing tutor mode, because when you get to the NBMEs, those are going to be timed and you're going to know your pacing at that point. So I've said that unless time has always specifically been a big problem for you, where you're like, I always have like 8 questions left at the end of a timed block with school or something. Like occasionally you get people where that's like one of their issues, and they basically expound that, and it's like, fine, you can do timed blocks, but you can just do tutor mode. Don't worry about your timing, and then when you get to the NBMEs, you'll be fine. That's how it is for like most people. Guys, give the live stream a like also. Champion, what's going on? Harsh, I love your content. Mac, in your view, why is medical school and resources full of superfluous content? Well, okay, it's because they're not geared toward USMLE. That's why. If we didn't have USMLE and there's like no metric that we're, right? If there's no like objective metric that we're studying toward, then the school can just teach whatever the fuck it wants. They're held accountable by the USMLE. Like the measuring stick by which a school is determined to be good or not is whether the students can do well in the USMLE. Because without that, they'll just teach their bullshit PowerPoints and their in-house exams, and like they can just blame you. But the USMLE allows the school to take the fall, because it's like, no, you actually suck. It's not the student's fault. It's you suck because you don't know what you're teaching the students. They get these random professors from like Romania and India who like just come up with these PowerPoints, and it's like these people don't even know like the USMLE. No shit, the students aren't going to do well on CBSE comp. And it's not even like just Caribbean schools. It's literally everywhere. It's USMD schools, difficult schools to get into. Like it's pretty much everywhere. I've had people at like Ivy League schools like not pass. I'm not fucking around. I've had that happen. And then the conversation I have is like, how is that possible? Because you're literally at like Yale. Like you're at Yale. How is it possible? Like you're meeting with me. You're meeting with some dude in Japan, and you're not passing step 1, when clearly in order to get into Yale, you had to have like 99th percentile in your MCAT or whatever. So how is it possible you're not passing step 1? So it's a problem with the schools. Like they're not teaching this. It's like, just do the NBME exams, do them all in QBank, and like you'd be fine. What's more accurate resource to know if you're ready to sit step 3? Well, you're going to study for that by doing QBank first, Mehlman step 3 QBank. Then you would do, I've said, the CMS forms. All those CMS forms that you do for 2CK, you're going to do this for step 3 also. Okay. Then you're going to do all the 2CK NBMEs. Again, for step 3. And then you'll finally do the step 3 NBMEs. And you're going to do CCS cases throughout. The percentiles align between the step 2 NBMEs and the step 3. It's not, the numerical scores don't align. It's the percentiles. Like if you're barely passing a 2CK NBME, it says you're barely passing a step 3 NBME. The questions are virtually the same. Like they are the same. They are the same. So it's about like percentile alignment more so than like actual numerical score when you're doing the 2CK NBMEs for step 3. But expect to score like 20 points lower on step 3 in comparison to step 2. Harsh. How should an IMG go for a rotation? Can you elaborate on that, Harsh? Do you recommend doing the offline forms for step 3, like 3, 4, 5? Yeah, you can. That's fine. Like do the forms for step 3. There's no reason not to. But I just have students, I'm just saying I have people do the 2CK NBMEs first, redo all of those. And some of you guys who are doing step 3, like for instance, there's still step 2 NBMEs you haven't sat. Like I have step 3 students now where like they never sat NBME 15. Like they took it, let's say step 2 back in 2023, and they did up through 14, but like they don't even have 15. And I'm like, cool, well you got 15 as like a form you can use for, untouched. The honored one, the last match having contacts at a program went a long way. My buddy matched with a 245 and then your sentence ended. At the place he had had the contact with people with lower scores matched at better programs because they had contacts there. Yeah, that's how it is. The first anecdote, it's been so many years, it doesn't matter at this point. I'll just say it. It's not like I'm giving away the identity. But when I was in university and you're undergrad, we're talking about, not even med school. There was a guy I knew when I was 18. And I found out he ended up matching into ortho at Duke. And that's obviously very prestigious, right? Oh, wow, ortho at Duke, holy shit. And he told me he got a 235 or something. This was back in the day when getting a 235 on step 2 would be getting a 245 today. But it's not a high score. But he had a 235, a pretty low score. That was on step 1, which was the exam that mattered more when it was numerical. The point is that he had a low score, and I was what the? He's I rotated there, and they really liked me. That's what he told me. He's I rotated there, and I did a really good job there, and they liked me, and then that's it. It's what I was saying the other day, guys. They'll take people with lower scores if they've demonstrated competency, because sometimes people with high scores that they'll accept, and then they find out that they suck. So scores matter, but there's enough anecdotes that those admin deal with where they'll take someone on with a high score and then find out that they can't do basic tasks, or they're sloppy, or they don't know how to write a note. That's what they must experience. And I know they must experience that because I experience that when I take sometimes new people on my team who score really high. And I'm this person sucks. And then we soft fire, which means we don't say, you're fired, get out of here. We don't say that. It's just we just stop. We're not letting you do things. And then they just fade. And then after 18 months, they're oh, I got to do it. And it's go. Dr. Mike, I really appreciate, I want to know your opinion on this plan. My step 1 exam is in 3 weeks, and I've done NVMe 24 and I got a 61. Postpone, because you need a 65 to pass, and that's by 1 question. And you need 3+ NVMEs at 68+, Queen Gold. So I would postpone. Now, what you can do, if you say, no, I don't want to postpone, what you can do is just sit other NVMEs, sit 2 others. And then if you don't pass, if you're not going to break 65, I'm nah, you got to go to QBank. So if we were sitting down together and you're very, very much in opposition to postponing, I would say it's fine. Just sit 2 more NVMEs, do well, and then you don't have to postpone. Problem solved. Queen Gold. Problem solved. Just do well in the NVMEs. But once again, even 65 is precarious. It means you passed by a singular question. So I want to see 3+ NVMEs at 68+. And you just have to be aware of the risks. At the end of the day, you can choose when you want to sit the exam. You can choose whether you want to YOLO. But it's, in my experience, that it's better to be conservative and not YOLO. It's better to postpone. Okay? We never want people to go in there hoping to pass by a question. It's never a good situation. Boyan Petrov, you lived in Japan for years now. Yeah, I've lived in Japan 9.5 years. 9.5 years? Yeah, over 9 years. How's your Japanese? It's fine. Also, thank you for the resources. You're the realest one out there. Petrov. Are you Russian? The honored one. I already read that. Farhan. Last 3 NBMEs, 70 plus, exams on the 8th of September. Any tips? You're good. You're fine. Just finish strong by reviewing the NBMEs as you're doing. If you haven't touched any NBMEs, like if there's like 20 offline ones you haven't touched, do those. Just make sure you're reviewing 20 to 32 and do 32, obviously, if you haven't done it already. Do NBME 32. But 70 plus, obviously, that's very good. Mike, you've done CMS, NBME 6 through 8. You're still getting 10 incorrects on CMS. Should you be doing Anki or something else? 10 incorrects on CMS isn't bad. But regardless, you're going to finish the CMS and then you're going to come back and you're going to do free 120 and then 9 through 11. And if you're 9 through 11 online, if you're not happy with those scores, then we can make a decision as far as do we want you to proceed to 12 to 15 or do we want to pull back and have you do QBank for another month? I'm assuming that you're probably like trying to apply this cycle and you're not going to be able to postpone. That's my guess. There's like a lot of people who need to sit before like the 10th of September to apply. I'm not an expert on the dates. Don't ask me about that stuff, but like there's like a few people that like they need to get their exams done by like the 10th of September, the latest. So if you're in that category, you'll just do the best you can. But once you do 9 through 11 online, if you're not happy with those scores, rather than going to 12 and upward, you can just, pull yourself back for an entire month. You could do Mehlman QBank step 2 and then go back to the NBMEs. Are there any tips to answer next best of management questions? Just practice. They're annoying, those questions. So, it's just, you're going to just keep doing QBank, right? Isn't that what you got to do? But those step 2 questions can be very boring. You're going to see a lot of patterns as far as like, the answer is fluids. Like if you don't know the answer and fluids is listed, it's usually the right answer. That you should know for the GI, the hepatobiliary stuff for step 2, the triad of nothing by mouth, they can write that as bowel rest. They're not going to write NPO on the USMLE. They'll write bowel rest. And so that's number 1. Number 2, fluids. And number 3, NG tube, which they'll write as NG, nasogastric decompression. That triad is what you're going to do for like a lot of stuff for step 2 and step 3. Pancreatitis, cholangitis, cholecystitis, like you do bowel rest, SBO, so bowel rest, fluids, NG decompression, that triad, it's high yield. Just want to let you know you changed my life, my confidence, my personal life, and getting through med school. Couldn't have been done without you. You passed the baton, man. David Gio, glad to see you doing well. Is starting with, that's not how you prepare for USMLE, David Gio. It's not how you prepare for USMLE. Have you done any of our videos on the YouTube, David Gio? Have you done any of our videos on the YouTube? Like the playlists, the MCQ playlists, have you done any of those? If you want to do videos, you've got a video QBank, a free video QBank, that if you did that alone, you'd honestly like pass the licensing exam. I think the Mehlman QBank's at the point where like the YouTube QBank I'm talking about right now. I think that's at the point where you could like, if you chose to just do that and nothing else, you would just like pass the licensing exam. Like Sans biostats, like you could do our course on that, for instance. Read our psych PDF, but apart from those 2 subjects, you could pretty much like pass USMLE just doing our QBank for the videos. That's all free. Guys, give the live stream a like. Vipul, Mike, I am. You're an aspirant from India. Vipul, I think you're 3.5 hours behind me, so it would be like 8:40 p.m. for you over in India, huh? Are you in like Punjab? Is that where you are? You in Punjab? Vipul? Did you have some naan today? I'm not being racist. I'm being serious because it's like that's an important question. It's a very important question. You got to have a good naan, right? Like a good naan bubble. These are important questions. Medex, hello to you too. Sharoon, hi for step 3. How are the days divided? Well, the first day of step 3 is a 2-day exam. Some of you maybe didn't know that. And the first day, it's all MCQ, and there's some step 1 questions that show up on that. I've heard this, okay? And then the second day is your MCQ that's like more clinical, and then you're gonna have the CCS cases that day. So you're just gonna practice those CCS cases every evening in addition to the QBank that you're doing for step 3. You got to do CCS cases like 3 every evening. They'll take you like 10 minutes each. So you spend like a half an hour doing like 3 cases before you go to bed. That's what I have like step 3 students doing. It's to my observation that the CCS cases tend to be the rate limiting step for those of you studying for step 3. In other words, your knowledge base tends to be pretty good when you're studying for step 3. Like a shitty step 3 student is actually way better than like a good step 1 student usually. Like a step 3 student will be like, oh, I'm so weak, I don't know anything. But like they'll get questions right. Like they'll be not bad because you're a doctor when you're studying for step 3. So you can be an incompetent doctor. You'd be like, I'm embarrassed, I'm getting stuff wrong. But it's like, it's okay, you're learning still. But usually people know stuff. So the point I'm making is that when we decide whether someone's ready to sit step 3, it's rarely about like, oh, I'm not going to pass the MCQ. Like that's very rare. The rate limiting step is the CCS cases. It's like, have you done enough of those? Do you feel comfortable and acclimated to the CCS interface? And so once you get past that hurdle, then we can have you do the step 3. Admir, can I go to step 2 with CMS, QBank, NVMe? Should I do any PDFs? It's difficult to do passive reading. If you're the type where you can't read, then it's not a big deal. Just absorb using, let's say, our YouTube videos. You can do our Anki, but you're asking like the CMS, Mehlman, QBank, NVMEs, you should be fine, honestly. You should be fine. Abdullah, you got 77, 80, 76, 79, NVMEs 9 to 12. Why are you doing percentages for those forms? Why aren't you getting your 3-digit scores is my question. Sit those online. Your exam's on October 7th. What should I do to push my score above, higher in the 80s? Well, you're already probably mid 240s. You're probably around mid 240s. So I'd say 240s around like 74%. So you're probably like mid 240s. So your question, I'm going to translate this for you. You're scoring mid 240s on the NVMe so far. How do you get into the 250s and up to 260? And your exam's on October 7th in 5 weeks. It should pretty much be, did you do 6 through 8 offline? Did you do the CMS forms? So do the CMS forms, do 6 through 8 offline, do free 120, and then you can do 13, 14, 15. That's what you can do. You can, another option is you can bust out Mehlman QBank. You could literally do that for a month. That would get your scores up. You could do that. Solomon, what about step 1? When is the best time to take it? It doesn't matter. Someone asked this yesterday in the live stream. You can take step 1 anytime, the exams anytime. It's not going to affect your scoring. So there's sometimes people think they take it in summer or winter, doesn't matter. It doesn't matter. So they offer the same test throughout the year, and those forms are scaled, pre-scaled. It's not in relation to when in the year you're sitting in. Devani Sony, after UWorld for step 2, should I use Amboss or Mehlman QBank? Guys, what do you think? What do you think? Should you do Amboss, or let's ask the content creator directly if you should do like their content QBank, or if they should do like, or if you should do like the other. Let's just write it as other. So the translation of your statement is, your QBank's new. Can we be confident that it's going to get my score up as much as possible? Or should I go with or in my mind, should I go with something what could be less risky because they've been out for a while? That's actually the translation of your question. Well, you've already done UWorld. So I've said, for instance, if somebody is like apprehensive to like only do our QBank, you could do like UWorld and Mehlman QBank, and you'll see ours is better. But the fact that you've already done UWorld, just go to Mehlman QBank. You know, the sequence of UWorld followed by Amboss, that's massively cuck. That's a low IQ sequence. MedX, so I was wondering how to master biochem. Just do our biochem PDF. It's a great PDF. And then you've got of course, the biochemistry modules and the biochemistry Anki cards. You can do those. Biochemistry playlist on the YouTube here. All that stuff's really good. So do the PDF in biochemistry, do our YouTube playlist on biochemistry. That's free. And then the modules and the cards, you can add those on if you want. Sharon, is there any clear distinction between day 1 and 2 of step 3? Yeah, I said day 1 is they've got some step 1 content on there. Like, you'll be getting all these highly clinical questions, and then you'll get one that's like, what's the mechanism of action of clindamycin, 50S ribosomal subunit? I'm not fucking around. There's people getting questions like that. It's not a big deal if you know your stuff. But for some of you, you like freak out. You're like, I'd be happy to get those questions. Enrique, is path the most time efficient to study? Well, path is very broad because path is encompassed within all of the subject domains: cardio, pulmonary, renal, etc. General path, okay, like histopath, cytopath, all that stuff is in our path PDF. Basic genetics as well as in the path PDF. Not like the Hardy-Weinberg stuff. I'm talking about like just, you'll see a lot of the high yield gene, the cancer genes, for instance, tumor suppressor oncogenes. So that's stuff you got to know, obviously, for step 1. It's important. Guys, give the live stream a like, por favor. Admir, should we do marked and wrongs from QBank second time for step 1? You did them in 8 hours, in 8-hour blocks daily in 1 week without reviewing again. I'm not sure of your question, but I would not say you have to do marked and incorrects from QBank. Now, that type of remediation comes in somewhat optionally if your NBMEs aren't where they need to be. For example, if you finish Mehlman QBank for step 1 and you were to do NBMEs 20 through 25 offline and we're not happy with your scores, we could have you remediate by going back to marked and incorrect questions. But you don't have to front load that stuff. You don't have to, in other words, you don't have to do like Mehlman QBank once and then say, I'm not going to the NBMEs yet. I got to do all my incorrects first. You don't have to do that. You don't have to front load all that. Same with step 2. Let me see. Chat moved on me. Here. Mike, you used to like dumb low IQ questions in your old live streams, but now you like convos to be geared toward USMLE prep. It's more like it's a business, and that's just what I see as like necessary to do. I don't mind answering like questions about me, but like you guys in the feed, in the live stream right now, do you want like Mike's life story, or do you want like your USMLE questions answered? You know what I mean? But it is after midnight here in Japan, and That's right. I answer the same dumb questions daily. Harsh, you say you want a rotation. Now we're on the topic of Yale because I brought it up. If you want a rotation at Yale, how do you approach the university and what should I include in my CV that will allow me to rotate? You would have to go to conference. My guess is you would have to go to conferences. You'd have to look up people at the school. What I would do, and this is what I actually did when I was in med school, is you would look up people at that institution whom you would want to connect with. And you would look up if they're doing like presentations somewhere, conferences somewhere. And you would have to have the ability, you would need the ability to travel to those places. And you could say, there's like a cardiology conference. There's this dude at Yale, this surgeon. He's going to be speaking at this conference in like 2 months. I'm going to go to that. I'm going to fly to that conference. And you say, well, that doesn't seem efficient. Well, that's the game. And some people have more poker chips than others, But those are the types of things, because if you send an email, no one's going to respond to you. They're just going to be like, they'll just filter you through the normal channels. But you could potentially like meet someone in person, get their card, and then you could send an email like later on, a very, very, very brief email, and introduce yourself again, just so they know your name. But you have to be very, very, very brief and not annoying. And don't talk about you and what you want. You would email them and just say like, you would just kind of praise them a little bit, but just so they maybe identify your name. Okay, and you could ask them how to apply to their program. So you just say, I saw your poster presentation. It was really good. It was great seeing like what you did. If somebody were, and you had met them in person, if somebody were to want to apply to your program, is there a way I could do that? Is there someone I should reach out to? And you can see if they respond to you and tell you, okay, you can reach out to this person. That's what you gotta do. Will you ever retire? If I retired and we're talking, like you say, oh, you could retire in your youth. If I retired, it would entail, I would just study Japanese all day. I would do my version of retiring, quote unquote, would be, I would study kanji like 12, 14 hours a day. And I would try to sit the national Japanese kanji exams. They have like certain levels of kanji exams where like there's the percentiles of like people who know those kanji. And I would just like do nothing but kanji for like 14 hours a day. That's how I would retire. And I would be smarter at like at age 70. That'd be really weird. I think that would be like a surreal thing. I'd be like, I'm smarter at age 70 because all I do is like visualize fucking kanji characters in my sleep and shit. I'm smarter at 70 than I was at like 20. I think I was smartest at age 20 because that's when I was like deep in organic chemistry. I thought that was like the best. I think that was the most interesting stuff I've ever studied was organic chemistry. But I think I see relationships between like kanji and organic chemistry. And that's how I would retire eventually. Maybe. Because I also have like various Japanese relatives that don't speak English. So there's people in my family who only speak Japanese. I'm part Japanese. I don't think some of you knew that. Grace, you're coming from an IMG. You're not really sure how do you even begin USMLE prep? I honestly feel like there's just way too many materials, and my year of graduation is like 10 years ago. if your year of graduation is 10 years ago, you're going to be starting from scratch again. Literally, you know nothing. So you would need a year, maybe. You would just study. You would study for step one, go through Mehlman QBank step one. You do obviously all the MDMEs, 20 through 32. You do Mehlman QBank step two. You would do 6 through 8 offline for step two. You do all the CMS forms. You do free 120, 9 through 15. You would do step three, Mehlman QBank. You would do, and you could bypass the CMS forms and the TCK-MEMEs because of the proximity of taking step three immediately after step two. You wouldn't have to restudy those, and then you could do the CCS cases. You could get all the medical licensing exams done within a year. But you would need all those exams. I think if they saw the proximity, your application, they're like, oh, she graduated 10 years ago. That's obviously a big, big negative. However, they would look at the dates of your USMLEs. That's like this. If they were considering you, they would look at the dates and they'd say, oh, she literally sat all the fucking exams like this year. That's recent competency. And that could, at some programs, possibly override the distant year of graduation that you have. Champion, is that anecdote a soft firing related to you? I don't know who you are, though. I'm not talking about, that's not, if somebody dabbles and tries to make like questions for like social media stuff, like what I do with the Instagram posts, I write all those questions. I've had some people try to like write some of those questions and they're like not good. They're like not as good as I am. And I'm just like, nah, it's fine. I can do it. I meant more like you get people who score really high on USMLE and they're like not good with like teaching and organization and common sense. Like their brain is very scattered. And I'm like, how are you smart? So there's people who score high, but they're like not smart. And then they get soft fired. Because if you're like brutal with someone, I'm not friendly. So like if you're brutal with someone, then they'll just go bitch. That's what people do. They bitch. So if like someone's DMing me and then like I block them or something because they're really annoying, what do? They go on Reddit and they bitch. That's what people fucking do. But you can't really like control what bottom feeding, like ocean bottom feeding, grimy people do in the ecosystem. Can you? Right? You kind of have to like distance yourself from a lot of that like peasantry, the grimy people in the ecosystem. Jamal, are you going to do any Anki for neuroanatomy? I think I saw you ask that. Where did you ask that? Was that in the Telegram group? No, but our Mehlman QBank has a lot of neuroanatomy in there. So if you need questions for like neuroanatomy, you can do that in Mehlman QBank. Devyani, you're a second-year med student. You're giving comp next year as well as step one. How should you begin? You've never been able to learn from flashcards. Is there an alternative to that? Yeah, just Mehlman PDFs. But if your comp's next year, then you should be on QBank right now. You need to be doing Mehlman QBank. And you could do Mehlman PDFs simultaneously. I said that. So you could do like 40 questions per day for Mehlman QBank, and then you can do like 20 pages per evening in the PDFs. And you would also do the YouTube playlists that we have for the subjects. So if in school you're doing renal, you could do like the renal playlist on our YouTube. You do the renal PDF. And that's in the evenings. But earlier in the day, the 40 questions you can do untimed tutor random mode. Jerry, banana smuggler. Hey, Mike, I'm struggling on my shelves. You failed psych by one question. I'm really frustrated with the NDME questions. I'm having trouble interpreting them as I feel they are sometimes wishy-washy. You just need more practice then. But I can understand, because it's really annoying, because psych, those questions are like very, very long and meandering and boring. So you should look at Jerry, you can look at the psych PDF that we have. That's what you can look at. Right? I had a student yesterday where he does psych. Like he's in residency for psych. And he like is like over the top as far as like how much that psych PDF helped him. Like he says he got like 100 on his psych shelf when he read the psych PDF. And that was like the reason he came to me. He's like, you have no idea. Like he won't stop with like how much that PDF helped him. But he got like 100 in med school on his psych. And you'll do the psych CMS forms also. You got to do those. YPK, you've got a week left before step 2. You're planning to do NBME 15 and free 120. But most of the forms you've done were in the 220s. How do I get over the hump to be in the 230s? If you've got a week left before step 2 and you've got 15 and free 120 remaining, well, you just have to do those 2 forms. There's not going to be really any magic tricks between now and a week from now. Apart from just consolidating around the NBME content and sleeping well. That's what you have to do. Far on. Thanks, Mike, for all the things you do. RTC, are you still going to do these lives when you blow up and get 1 million subs? What, in like 10 years? I grow very, very, very like slowly. But the engagement is good. You know, I'm not some like dancing like female where you get like you go viral on that shit. But let there be no confusion that like people understand I'm the educator in the ecosystem. So you can have somebody who's got like 1 million subs, right? In USMLE, you're like, this person's got 1 million subs, but they're not an educator. All they do is, you know, they're like Indian with glasses and they hold up their like FA or whatever. And they're like, it's like peasantry stuff, but they're not actually like, no one like looks to them and says, oh, they're the educator. They're an educator. No one thinks that. So I don't want to get too much into like business talk. I don't really want to go too much into that, but let's just say it's more about, we're just more concerned about like making sure you guys have good content, and that's what we focus on. And then those other metrics can be a positive that comes secondarily. Mac, do you think that people who take too long to study do worse than someone who studies hard for a short period, like a hyperbolic curve? I don't really think so necessarily. Like, just people are going to have different study habits. I took too long to study back in the day. I have some students who are very deep and meticulous with their study. And so study's hard for a short period might just mean efficient. If you're, you know, you just have to be very efficient and study the right things. Because when you take too long to study, it entails like studying a lot of things that don't matter. So when I say I studied too long back in the day, it was like reading a lot about things that didn't matter for the USMLE. Like I read Robbins when I was in second year, and like that didn't help me for USMLE. I read a lot of resources for USMLE that I thought would help me for USMLE, and they like didn't help. Jerry, you'll know the diagnosis, treatment, distinguishing features, answer choices because of how they word things. What's your question, Jerry? Kevin Yangle. I keep getting 73-ish, NBME's 20 to 23. What can I do to get a higher score? Obviously, those are good scores already, 73-ish. Just continue with the NBMEs right now. And as long as you're getting 68 plus on the NBMEs, you're good, because 65 is pass. So 68 plus is what we're looking for. 70 or 73-ish, obviously, great scores. And I'd want to know when you're sitting, but I'm assuming it's not too far in the future. But just continue 24 through 24, 25, NBME, 24, 25 offline, free 120, 26 through 32. That's the sequence I want from you. Hasmitha recently found you with your content and your style. Harsh, you see a lot of neat people. Abdullah, you're dropping 4% NBME 31 from 72 to 68. What should you do? I've said that you're not actually dropping. It's coincidental. So in other words, if you, let's say, take like NBME 30 and you get a 72, and then you take NBME 31 2 days later and you get a 68, and you're like, oh my God, I dropped. You didn't drop. Because if you coincidentally inverted those forms and sat 31 before 32, you would have thought you went up by 4 points. But let that speak to how the real exam will be, because your real exam can fluctuate depending on which cubicle you're sitting in and which form you get. It's luck. So as long as you're not getting any scores where the lower boundary is below 65, then we're fine. I don't like if you hit 65, that's precarious. But as long as the lower boundary honestly is 68 plus, then we're not worried for the most part. We're not worried. Hasmitha, Pradesh, India. Andhra Pradesh, India. I don't know where that is though. But it's not Punjab is what you're saying. If someone's from India, I just like reflexively ask them if they're from Punjab. And then if they say like, yes, I'm just like, yeah, you seem like you're from Punjab. Then I like troll it. I'm just like, yeah, you seem like you're from Punjab. And they're like, how do you know that? I'm like, you seem like you're from Punjab, even though it's like, I don't know what the difference between Punjab and like, you know. Kevin Yangle, is there a question in MUME where a patient lost taste and the answer is cranial nerve 1 or 7? Yeah, that question is like not hard and everyone has like confusion with that. I don't know what the problem is. Think of it this way, okay? If they tell you you lose taste only, that's going to be olfactory, not facial nerve. How do we know that? Have you ever heard of somebody with a facial nerve lesion where they only lose taste? The answer is no. Wouldn't they have a Bell palsy? Right? You don't like have something affect your cranial nerve 7 and then it's like only the branches to the anterior 2/3 of the tongue for taste are affected. You would have Bell's palsy. You might even have hyperacusis ipsilaterally. If you had like, a Ramsay-Hunt syndrome type 2, reactivation of VZV, you would have like Bell's palsy, you'd have potentially hyperacusis. Like you would never have an isolated loss of taste, ipsilateral 2/3 anterior of the tongue nonsense. So that's olfactory, that one. Harsh, you're from Delhi. Vipul, Maharashtra. Sunday naan and butter chicken. There you go. There you go. There's a big Nepalese community in Japan, not really Indian. I don't think I meet any Indian people here. I meet Nepalese people. And they're all poor. They all work at like hotels. They'll make like $30 a day, or they have their own restaurants. That's like what they do is they own their restaurants. They're very hard workers with restaurants. But the people from Nepal who come here are very, very, very poor. Alparan. Hi, Mike. You're from Turkey. Thank you so much. I spent time in Istanbul. I might go to Turkey this month. Actually, September in Japan already, past midnight. Because I'll probably stop doing these live streams this month. And you guys wouldn't even know I travel because I can do those YouTube clips. I can do like 15 of those in a day. I could pre-record those. I could pre-record 30 clips in 2 days, and you wouldn't even know that I left the country. But I probably won't do that just because it's too boring to do that. Alex, you're 5.5 weeks from step 1. You did form 20 yesterday. You got a 66. You're rounding down. Reviewing the exam all day. Should you be doing in forms 25? Why would you do 26? No, you said, sorry, you did form 20. You got a 66. I would just go in numerical order. I would do 20 upward now. Don't jump to 25. And 25 is offline. Remember that now. It's 26 to 32 online now. So just continue with 21 upward. And when you finish 25, then do free 120. And then 26 to 32 online. And we want to see numbers 68 plus. That's what we want to see. Let me see. Where was I? David Gia, you felt that going through the QBank without studying first aid would be a bad idea. Correct me if I'm wrong. That is wrong. That is wrong. Could you imagine thinking that in 2025, first aid is the way to prepare for USMLE? Could you imagine? Like, whom have you been listening to? That's like 2016 advice. It's amazing. It's amazing. Highland, CCSC. Okay, FA, IQ. I won't skip your question. Double pass the CMS forms. Should you start with third or first exam? Exam on the 15th of October. Little. I don't know what your question is. Please write that more clearly. FAIQ. Highland, CCSE exam next month. Please recommend what's your most important to review. Next month, you're going to do, it's the same as the step 2. So I'd want to have you sit at least half the NBMEs for step 2, and you'd want to be on the CMS forms. If you're on QBank still, you can do Mehlman QBank. If your scores are really low, be doing Mehlman QBank. Mohammed, your step 1 result, your arrowhead of fail was quite below the hostogram and passing mark where they're shown. Okay, so you failed by a lot. Your NBME scores are around 65. I would not have had you sit when you're getting only a 65. I consider that YOLOing because it means you passed your NBME by a question. And how many NBMEs did you get that were 65? Did you sit 20 through 31? I mean, I'm sure you didn't do 32. Did you do 20 through 31? And free 120? Did you get what were your percentages on those? Because the NBMEs don't lie. Andrea, thanks for being a member. KB King, I'll ask a question, but don't be angry and answer the question. Okay, KB King. DM, what are the psychological differences between people who are poor and those who are rich? People who are poor are much more resentful. So people who, for example, they act very angry about high prices and prices out of their reach, and they attack people's character based on prices. Those people are grimy poor people. Those are like people who wear white t-shirts at Walmart, and then they go on Reddit and complain about prices. That's like the bottom peasantry in the population. People who have more affluence, they're less disingenuous and they're more generous. They don't complain as much. I'd say it's mainly people without money are more resentful. If you're impecunious, where you don't have money, you're much more parsimonious and resentful. Okay? say cheap ass, no money, or you could say parsimonious, impecunious. Okay. Ali H, Dr. Mike, what score do you recommend on the ComSay to pass ComLex 2? You scored below 400 on ComSays. I'm not an expert on ComSay. What we care about is you could do the NBME equivalent. Like you would basically, they translate over percentile wise. So for example, you could do NBME 20 for USMLE step 1. And if you get like a 60% where you fail by 5 percentage points, we would basically say, well, that's the equivalent of you failing the ComSay by like a little bit. You understand? So I don't fixate on the numbers for the ComSay, but we know that the percentiles align. Yeah, like that's my experience with DO students in ComLex. You're talking about ComLex 2, not 1, but it's the same thing. So you could sit like NBME 6 offline or do NBME 9 online. Your percentiles will correlate. Then you just got to self-study the annoying OMM stuff with your blue book or your white book or whatever it is. There you go. Ali H, you asked, will you add OMM to your question bank? The answer is no. We could make like a ComLex QBank, like we could, but it's pretty much like you can do the step 2 QBank and that's enough. You could do our step 2 QBank and then self-study OMM. Like I would recommend you do like ComBank. You do ComBank for level 2. You would do Mehlman step 2 QBank for USMLE, and then you would self-study OMM. That's how you would study for ComLex 2. That's what you would do if you came to me. I'd be like, do ComBank and Mehlman QBank step 2 at the same time and self-study OMM with like your white book or blue book or whatever. That's what I would say. Twin cylinder, can we get more psych questions on YouTube? Not really. Psych's really boring to do for YouTube, isn't it? When you guys have requests for like ethics questions or like psych questions and stuff, I look at the analytics. Like if I make a clip where I title it like, you know, question 1461 ethics, the views will be like 30% of what like they normally are. Same with biostats. You guys don't like that stuff. So you'll be like, post more biostats, and then you do biostats question, it gets like no views. So it's not that I can't do those. It's just psych's really boring in my view. Psych, you need like long question stems usually. And YouTube, it's like better to have shorter questions. Do our psych PDF twin cylinder. Roger Moore. Do you have all the NBMEs grouped together in a file or is it incorporated in your QBank? We don't incorporate, that's not like really the wording in relation to our QBank. Like we don't use NBME questions for our QBank. Those, what we make is completely unique and unrelated. But we know what's on the exams. Like we don't just like invent out of thin air like what we think you guys should know. That's like what Kaplan used to do, had bad reputation. Like we know what's on the NBME, so we teach similar concepts. So our QBank is most updated with being most similar to the NBMEs. Abdullah, you're dropping, I already saw your post like 6 times. Can you give me some advice? Can you give some advice to my wife on how to deal with me studying all the time and being stressed and due to my medical program? The advice I would give, it would not be like politically correct for most people. Because it would be in my view that you would study and you would get the work done that you need to, and it's not something that you have to explain that needs to get done. It's something that should be understood and accommodated for. So it's not a situation where you're like, please, baby, I got like more I got to study. No, it's a situation where it's like, you're doing the work you need to do. And, she's going to bring you the steak when you're like, but that's not like politically correct. It's like, Mike just said a wife should bring a steak for the dude while he's studying. That's not good. Women shouldn't cook a steak. I mean, dudes do know how to cook steaks better anyway. It's like, I've got Hina. You got your exam on the 16th. Your UWorld self-assessment was really bad. You've done revision 3 times, but I don't know what's happening. Well, if you're not passing, then you have to postpone, right? I don't know what your scores are. Hina. Nick Rana, good to see you again. Yeah, that's what I was talking about, the kanji kente. I haven't done that, but I was naturally really, really good at kanji when I did the immersion school here, like 8-9 years ago. Let's talk about school. Let's talk about like our performances in school. Isn't that like a nice conversation? But I was really bad at listening. I had classmates that like were really good at like listening, like when they do those like tape recordings, like you're in 7th grade, and they like play like elementary level like language, like Japanese, and you have to like answer questions based on what you hear. It was literally like I was in like 5th grade, and I was like, I don't fucking understand what they're saying right now. And then like I had classmates who were like, this is so easy. What are you talking about? So easy. You just and I had like asked this girl next to me. I had a classmate where she like failed all like the actual like Japanese, but then she like could understand everything that was spoken. She's like, it's so easy. You just listen. But my kanji was like, I was like 4 levels ahead of like everyone in my class for kanji. I like my classmates were learning like 6 a day. I was learning like 24 a day. Like kanji was really easy for like I can visualize that stuff easily and do that. That's like, and I was saying like when I retire, eventually I would do kanji study like 12, 14 hours a day, and that's what I would do probably. I'll start a YouTube channel if YouTube exists in like 30 years. I'll start a kanji YouTube channel. They'll be like, whatever happened to that dude that did like the medical stuff, whatever happened to that dude? He does like kanji now. Nick Rana, you bought your baby, bro. You're the step 1 QBank. Very good decision. Pal Geo started preparing for step 1 in 2nd year med. Will I be ready to take it at the end of MS3 since that might be easier for me? You don't want to take step 1 at the end of MS3 if you can help it. People who have to take step 1 after clinical rotations, it causes headaches because you'll be on rotations and you're going to want to co-study for your rotations, and it's very difficult. So if you can help it, get the pass out of the way before you go to rotations, absolutely. Guys, I got to wrap this up because I got a student. I got a couple students. I got a Zoom call. Let me see. Let me just scroll through some of these. You should definitely visit Mumbai. I almost went to India when I was in med school. I got like the Hep A vaccine and the typhoid vaccine. Like I planned to go to India and I didn't end up going. I like traveled other places instead. I was planning on going to like Russia and India, and instead I went to Fiji. And Fiji was great. But I lived with it when I was in 4th year med. Before I moved to Japan, I lived with, when I was in Australia, I lived with an Indian woman and her son for like 6 months. That was my 4th year of med school. I lived in like a house, with an Indian woman and who's like in her 30s, and her like 10-year-old son. And she used to like hit him. when he was doing it. Like I'd be in like my room, like studying or something, and he'd be doing like math, like homework out in like the lounge area, and she would like smack him, and he was like crying. And I was like, do I like contact Child Protective Services? Like, what the fuck? And like I had I've had a lot of Indian students, but like one of them was like, yeah, that's like normal. She's like, I got hit. I was like, that's like not normal, but if you think that's normal to like smack your kid because they can't do math homework. But I lived with that was my final 6 months of med school, actually, before I moved to Japan. She cooked good food. I'll answer one more. I gotta go. Guys, I'll do more of these. Maybe.